Good morning, everyone. My name is Janavi, and I want to share with you my wonderful experience of my JFE in India. The title or theme of my experience is Discovering the Inside Story of Laboratory Diagnostics and Gynecology. I did my internship at two different places. It was split into two in part one and part two. Part one was at a friend's diagnostic center, which is a lab, and her lab run by pathologist Dr. Sharada, which was opened in 1997 and is located in Trichy, India. Part B was at a gynecology hospital called Lalita Nursing Home, and it's run by Dr. Chitra, and it was opened in 2003, and it's also located in Trichy, India. My lab mentor was Dr. Sharada, and she opened her lab in 1997, and she's attended about 12 to 13 conferences. She's also a very involved person in society, and she is part of many universities such as the SRM Medical School, which she also took me to visit over my internship. She's a professor at SRM, and she's also on the administration board of the Bishop Herbert College, and she's part of the National Board of Exams of India. My gynecologist mentor was Dr. Chitra, and she opened her hospital in 2003, and she's also attended numerous conferences also. While I was there, she had to attend a conference in Israel, which is why I was left with her daughter, Dr. Akila, who is also a gynecologist. So technically, my mentor was Dr. Akila. My main tasks and responsibilities included in the pathology lab in part one, I was to complete blood count tests using the CBC machine and also observe other lab procedures. During my first 3 days at the lab, I was exposed to the different machines. There are 3 labs located within the diagnostic center. There's a microbiology lab, a pathology lab, and a biochemistry lab. And my first 3 days were spent in each lab learning all the lab machinery and how to use them. And then after I learned that, I would continue my 2 weeks in the different labs and learn how they did their certain procedures. In the gynecology clinic, I spent half my day in the scan room observing fetal scans and the other half in the outpatient consultation room. My first half would be in the scan room where I could witness a great variety of scans starting from the 6 to 7 weeks fetus all the way to 38, 39 weeks fetus. So I got a great variety of fetal scans and how the baby develops and what develops at each stage. And after that, I would visit the OP consultation room where I would sit side by side with the doctor and observe how she diagnoses, how she provides treatments for outpatients that come in. Mostly the types of patients she gets is infertility because Dr. Chitra and Dr. Akila are both infertility specialists. So most of those patients would be the ones that come with the most frequency. So I observed what kind of treatment options she provided for them, how she dealt with patients, mostly patient ethics is what I learned from her. My expectations, I was really expecting a serious and professional workplace. Of course, since it's a hospital, there is definitely a limit, there's a limit to of professionalism that is expected of everyone, and that was definitely, I upheld that, I believe. So dress code was normal Indian dress, and it wasn't extremely serious. People were kind. During their break time, they offered me tea, coffee. So it was a pretty decent workplace. And interaction with patients, that was fulfilled, not in the lab, because there were no patients in the lab. They saw test tubes and samples and specimens. But in the gynecology, in the OP consultation room where I spent about 2 to 3 hours of my time, there I got to meet with many patients, and I definitely got some interaction with them. I learned the lab procedures in the lab. Definitely, I visited all 3 of the labs and learned their different procedures, which I'll talk about in a few moments. Experimenting with real tissue samples. I did get to experiment with real tissue samples at the SRM Medical College, which my mentor took me to. There, I didn't get direct contact with them, but I definitely saw how to process them, how to fixate the tissue, and how to get it ready for preparation, how to prepare it, and how to make it ready for observation and mounting on microscope slides. Laboratory diagnostics. I got exposure to 4 different types of labs. There are direct access labs, referral labs, hospital labs, and teaching institution labs. The lab I worked at was both a direct access lab and a referral lab, meaning that it receives samples directly from patients and also samples that are referred from other physicians or hospitals. And I also visited a hospital lab at Med All, which my mentor also took me to, and I will pass around their brochure. That's a hospital lab, and hospital labs are located within hospitals. Teaching institution labs are labs located within universities, and that one was the one I visited at SRM University. Now for what I really did in each of the labs. The biochemistry lab, my first day was spent learning all the machinery used in each of the labs. So these are the main machines used in the biochemistry lab, and the three most important ones are the hormone analyzer, and then the one over here is a fully automated biochemistry analyzer, and the CBC machine. The hormone analyzer performs all sorts of hormone tests, thyroid glands, all that sorts of tests. And this machine, the fully automated biochemistry analyzer, does pretty much everything. And this CBC machine is what I work closely with. After I learned how to perform complete blood counts with this machine, I would get the blood samples and take results using this machine and save them for the techs to come look at later. At the pathology lab, these are the main machines used. This is the automatic tissue processor, which I will talk about in a second. This is the key, the center point of a pathology lab, and that is the cutting machine, which after the tissue has been mounted, after the tissue has been molded with wax, they would use this machine to cut it, and I'll go through the tissue processing in just a moment. In the microbiology lab, there are all the machines necessary for bacterial growth, all the machines that are vital for bacterial growth, and that is most important, a sterilizer, hood, incubator, hot air oven. This right here is the incubator, and that's a sample bacterial slide. And the main procedure there was the process of sensitivity and resistance, which we all have done with E. coli in biology, I believe. So they measured the zones, and they applied different types of drugs onto the bacteria and see which are resistant, which are sensitive, and thus they can diagnose. Some sample tests I saw done there were the osmotic fragility test. And that test is done to determine under which osmolality a patient's red blood cell lyses. And this is done for in case a patient comes and complains of internal bleeding, like if they find that they have internal bleeding or excess bleeding. This is done to determine under which osmotic pressure their red blood cells lyse. Another sample test I saw being observed is the HbA1c test, and it's done to determine if a diabetic patient's blood control is under level. And using this test, you can also determine whether the patient's been taking their medicine on time, whether or not they had breakfast, whether or not they're eating at the right time. All of this can be determined using this test. Now, this tissue fixation is what I said I would address in a moment. This is the main procedure. I'm not going to go into too much detail, but this is the procedure of fixating a tissue. So if, for example, if you were to remove a uterus from a patient, at the time of surgery, it would be really bloody and gooey and wobbly and not exactly ready for observance by a doctor. So they would first take that uterus and they would, let's say there's about 10 different glass jars here, and they would dunk it in each one and fixate the tissue. Formalin is a fixative substance. It hardens the tissue and it puts the cells of the tissue in a paralyzed state or in a sleeping state for them to fixate. Next was gynecology. I observed fetal scans, and I put this one in here because this is one of the most vital ones, the 12 weeks anomaly scan, and the brain, heart, placenta, spine would have all developed. And in India, this is a critical one because at this 12-week scan, they would do a special anomaly scan that can determine whether or not the baby will have any neurological disorders, such as Down syndrome or any other neurological disorder. And if the baby does seem to have it, they will consult with the patient on whether or not to terminate it if it's really serious. Because if the baby's born with a problem like that, you're going to have to spend too much time and effort to treat the baby. So they see whether or not to terminate it or keep it or treat it within the womb if possible. And my second half was in the OP consultation room where I dealt with infertility mainly. I just put an example. I've dealt with I witnessed over 30 cases, and I just put in one of them, and this patient came with infertility. The first one they do is take an x-ray to check for if there was a block in the tubes, in the fallopian tubes. If there is a block, it is very likely that it's not exactly 100% curable or treatable. It's really a tough treatment for it to clear the block in the tube, but they'll definitely proceed along with the treatment. If not, if there's no block in the tube, another possible reason could be that the egg release is improper. If nothing's wrong on the male side, if nothing's wrong on the female side, there's always a male side possibility. And in the future, I'll definitely take away from this experience, what I definitely will take away from this experience is that I really enjoy being in the medical field. And I have had so much fun being with the patients at gynecology and learning how to work with lab procedures in the laboratory as well. A bit more than the lab, I feel like I enjoyed the gynecology better because I was able to interact with patients and work there was a little bit more hands-on. And this internship, like, as it pertains to my SCE, definitely I'm going to stay in this medicine field. I'm enjoying this right now, so I don't think I'm going to go anywhere else, but definitely I want to change the scale or change to a different side, which would be more on a patient base. And this one was, my first one was a very lab-based one. That one was hands-on, but then patients was not very hands-on, but it was more interactive. So I want to try to find something that is hands-on and interactive all in one case. Thank you.